Hi, everyone. Welcome, and thank you for joining the Indivisible Emergency Call on Defending the Affordable Care Act. Very happy to be able to pull this together with such great speakers that we have lined up for all of you. Just quickly wanted to highlight, the two basic reasons why we thought this was an important time to pull this call together. The first is this is an important week. Republicans have been waiting for 7 years for this moment, and now with Trump in the presidency, they now have what they've been waiting for, which is an opportunity to roll back the ACA, to dismantle and repeal the ACA. They voted on this dozens and dozens of times over the last 7 years, but it really wasn't until November 8th when, up until now, there were no consequences to those repeal votes, but now people are actually about to get harmed with this effort to repeal and replace the ACA. They're trying to make good on those campaign promises that Donald Trump made. He's committed to undoing the ACA, to repealing it, and now Republicans, starting this week, are actually starting to do that. Starting tomorrow, Republicans will be voting on two Obamacare repeal bills, two ACA repeal bills, in the Ways and Means Committee and the Energy and Commerce Committees. These are basically the first votes on a substantive repeal bill. So that's why it's super important. Again, the reason why we're having this call is because this is an important moment. We have to basically be in 100% ACA defense mode. We're fighting for people's lives. The other side is fighting for big insurance companies. They're fighting for tax breaks for the rich. And so we have to be 100% in defending the ACA. The second reason why we pulled this call together is because we really want to sort of capture and maintain that momentum from the last recess. We saw an incredible display of grassroots activism just a week and a half ago, and you could really see it and feel it in all those town halls. We had hundreds of town halls all over the country. We had hundreds of thousands of people that went out and tried to talk to their members, tried to visit them at town halls, tried to made phone calls, visited their offices, and the top thing that they wanted to talk about, the number one thing that they wanted to tell their members is that they didn't want to lose healthcare. This was the number one thing that people talked about. That's how important it was. And so now it's time to do everything we can to do that. Even though we had hundreds of thousands of people out there telling their members that they didn't want a repeal of the ACA, still, this is what we're getting in Congress. Now we have these bills, repeal bills, that are getting votes this week. So we're very happy to be partnering with some of our close friends to provide the public and all of you information about what this really means. Like, why is this an important moment? What is in these bills, and what comes next? So I'm going to first start off with, we're joined by Lydia Mitz. She's the Associate Director of Affordability Initiatives with Families USA. And actually, I should say something first. We're going to have a number of presenters, and then following the presentations, we're going to answer some questions that we got from all of you, the ones that were submitted beforehand. So we're going to answer some of these. These are really great questions that we've gotten from a number of people. So stay tuned to the end for those questions. But first, I want to kick it off to Lydia Mitz. Again, she's Associate Director of Affordability Initiatives with Families USA. For those of you who aren't familiar with Families USA, this is an organization that's been sort of just instrumental in, they were instrumental in passing the ACA, have been super important in the implementation of the ACA, and now are super important in defending the ACA. So very happy to have Lydia Mitz with us, and I'm going to kick it off to Lydia first. So Lydia.
Thank you so much. So I wanted to kick this call off by giving a brief overview of the most harmful elements we see in these House repeal bills that were introduced this week, and that will have severe consequences for people's access to affordable health coverage and their ability to afford care. First, I want to talk about the harm that these bills would have on the Medicaid program. Medicaid provides health coverage to the lowest income people in this country. It is the key source of coverage for low-income adults, low-income children and seniors, and people with disabilities. These bills would end the Affordable Care Act's Medicaid expansion, effectively taking away coverage from 11 million low-income adults. If we step back, before the Affordable Care Act, low-income adults who weren't parents, who didn't have children, were typically blocked out of the Medicaid program and did not have access to coverage. The Medicaid expansion opened the door to their getting coverage and they're being able to access life-saving care. Repealing the Medicaid expansion will have dramatic effects on states' economies and their healthcare systems. The expansion has pumped billions of dollars of federal money into states' economies. It has created thousands of jobs in states. It has also been a key source of funding for hospitals and providers and has helped make sure that they can keep their doors open and can continue to serve patients. And so all of this is on the line if the Medicaid expansion is taken away. Beyond ending the Medicaid expansion, these bills would fundamentally change the Medicaid program as we know it today. Even before the Affordable Care Act, the Medicaid program has long been a critical source of health coverage and care for low-income children, for seniors, and for people with disabilities. This bill would cap federal funding to all states' Medicaid program and drastically change the structure of the Medicaid program. The way the bill is structured with these caps, its intent is to save federal dollars, and it ultimately will shift costs to the states. These changes to the Medicaid program will leave states with no guarantee that they'll have enough money to adequately respond to the unique healthcare needs of their state. And a perfect example of how much harm that this proposal could cause, if states have public health or natural disasters that strike their residents, like the Flint water crisis that we saw, and these disasters or public health crises lead to a spike in people needing care. With these caps as proposed under the bill, states will not have a guarantee that they'll have enough federal money to meet their residents' health care needs. And so these proposed changes in how Medicaid is structured and the cap on federal funding will ultimately translate to states being forced to make cuts to their program. And this means cuts to healthcare services for vulnerable populations that this program has long served. The bills that were introduced this week would also have dire consequences for millions of people who have gained private health insurance under the Affordable Care Act. And this is in large part due to the fact that these bills would drastically cut the financial assistance that working families get to help purchase coverage and increase and would really lead to families seeing a astronomical increase in their healthcare costs. Right now, the Affordable Care Act provides over 10 million people with financial assistance to help purchase private coverage and to reduce the monthly premium for that insurance. The way it works right now is that financial assistance is larger for people with lower incomes. It's based on the real premium cost where someone lives, so they can actually afford to purchase care in the city where they live. And this assistance grows as people get older and their premiums increase. The Affordable Care Act wanted to make sure that those that need the most help affording coverage get the most help. The repeal bills we see introduced this week would drastically change the financial assistance people get to purchase insurance. Instead of providing greater help to those with lower income, this bill would provide the same amount of assistance to people regardless of their income, with a cap on it doesn't provide assistance to people above a certain income, but for everyone that qualifies, everyone gets the same amount of help. Older people would get greater help, but it would not be anywhere near the amount of financial assistance that they see now. So what's the impact of all of these changes to financial assistance? The bottom line is that lower income people and older people in particular will see their financial assistance to reduce premiums cut by hundreds to thousands of dollars. And I'm going to give an example in a minute of how much someone's premiums could increase. On top of these changes and these cuts to financial assistance to reduce premiums, these bills would allow insurers to charge older people even higher premiums than currently allowed under law. So right now, the Affordable Care Act says that insurers can't charge older adults more than 3 times higher premiums than younger people. Under this bill, they could charge older adults up to 5 times higher premiums. So combined with the cuts in financial assistance, older adults will see their premiums skyrocket. And this is where I want to give you an example. So under these repeal bills that were just introduced this week, someone who is 60 years old and making around $30,000 would see their premium increase by more than $400 each month. And if you add up the monthly cost of insurance for them under this repeal bill, premiums would eat into 25% of their entire annual income. So lower income people and seniors have so much to lose under these changes to financial assistance. And so far, I've just talked about how people's premiums could increase. The story regarding how people's deductibles could increase is even worse. These repeal bills would completely eliminate the ACA's financial assistance that has helped lower cost sharing, like deductibles, for lower income people who are purchasing private coverage. Nearly 6.3 million people are currently getting this assistance. And if it's taken away, their deductibles, their co-pays, their co-insurance could increase by hundreds to thousands of dollars. We've looked at what it could mean for families at different income. And if you look at a family of 3 that's making just around $30,000, if this assistance goes away, their deductible could increase by more than $5,000. And so the bottom line really is that this bill would gut financial assistance for private insurance for working families. Millions would likely lose coverage because they're no longer able to afford it with less financial assistance provided to cover the cost of premiums. And likely, the millions more will find themselves in more bare bones coverage with much higher deductibles. And this scenario is particularly dire for people with pre-existing conditions who rely on coverage to help them afford treatment and ensure that they don't go into medical debt in order to get the care they need to care for their conditions. Being left only able to afford insurance with a $6,000 deductible is incredibly dangerous for this population. I know Planned Parenthood is going to speak to the devastating policies in this and regarding defunding Planned Parenthood, so I'll leave that to them. And I'll just close by saying that all of these cuts to financial assistance to help working people afford coverage and care, the cuts to the Medicaid program, are made while these bills simultaneously provide billions of dollars in tax cuts to wealthy individuals and tax cuts to billion-dollar healthcare industries, including drug manufacturers, insurers, and medical device manufacturers. And with that, I'll close, and I will turn it back to the other speakers.
Great. Thank you, Lydia. That's super helpful. I mean, this is really important. I think a lot of people don't really understand how this attack against the ACA also implicates Medicaid. Medicaid, they're trying to restructure and dismantle Medicaid, which, so many people, 70 million people use Medicaid in this country. So what they're trying to do is basically increase costs for consumers, increase out-of-pocket costs, and then getting rid of this guarantee that you have if you right now, if you're eligible for Medicaid, you can get Medicaid. But if they succeed in what they're trying to do, then it's going to lead to states. They keep talking about state flexibility. Well, what that means is people in those states, people are going to lose coverage. They're going to lose their Medicaid. So super important. Thank you for that, Lydia. I'm going to now turn it over to Angela Ferrell-Zavala. She's the Director of Strategic Partnerships at Planned Parenthood Federation of America. Again, Planned Parenthood is, I'm sure people know, I've heard Planned Parenthood, they've been sort of leading the way in protecting access to health services for women and families. So very happy to have Angela on. Angela?
Thank you so much, Angel, and thank you, Lydia, for your remarks. First, I just want to list up a few of the many benefits from the Affordable Care Act that we really talk about. The birth control benefit, providing no-cost birth control for millions. pre-existing conditions, as already was noted before me, and also young adults being able to stay on their parents' plan until the age of 26. So there's so many benefits of the Affordable Care Act, and it's unacceptable, this attack on healthcare. For many patients, Planned Parenthood is the only healthcare provider that they see. And so blocking them from coming to Planned Parenthood means that there will be nowhere else to go. And so we are frankly not going to stand for it. Planned Parenthood delivers vital reproductive health care, sex education, information to millions of women, men, and young people worldwide. And it's estimated that about 1 in 5 U.S. women will visit Planned Parenthood Health Center in her lifetime. And a number of recent national polls have shown overwhelmingly that the American people support Planned Parenthood. So let's talk a little bit. We heard a little bit about Medicaid, and that's very significant for Planned Parenthood because we have many of our patients that rely on Medicaid to get their health care. And so Planned Parenthood funding comes from Medicaid reimbursement, which is a combination of state and federal funds, Title X funding. Patients who use private health insurance are pay out of pocket. And lastly, from donations or other government programs and grants. So to be clear, defunding is really a misnomer, and it would actually have a very devastating impact on women and families. There is no blank check that Planned Parenthood gets from the federal government, and it's not a line item in a federal budget. Instead, this type of legislation would prevent millions of women who rely on Medicaid and our other federal programs from accessing a health care provider that's been there for them for decades. So as you can imagine, like many hospitals and clinics around the U.S., Planned Parenthood participates in the Medicaid program. There's federal funding for Medicaid and also state funding for Medicaid. When a patient goes to Planned Parenthood Health Center and uses their Medicaid insurance, the Medicaid program reimburses the health center for the cost of the patient's visit, just like it would any other provider. And at least 60% of our patients rely on government-funded health care like Medicaid. So as you can imagine, this is devastating for many folks. One of the things that we constantly are hearing in the narrative is this federal funding for abortion, which is also not true. The Hyde Amendment prevents that already. So it already blocks federal funding from going to abortion services. The legislation instead that they're proposing would block people from accessing cancer screenings, birth control, HIV and STI testing, and other preventative and essential care at Planned Parenthood Health Centers. This impacts people, of course, that are already facing many barriers to accessing health care, including low-income folks, folks in rural areas, people of color, and young people, also thinking about LGBTQ communities. So our motto is always care no matter what, no matter where you live or who you are. It should not matter. And as we saw over the past the week of recess, the congressional recess, folks were showing up and out loud saying this is unacceptable. So blocking access to Planned Parenthood is deeply unpopular. Repealing the ACA is deeply unpopular. So I'm hoping that folks will stand up and show out against this. But Planned Parenthood is definitely going to be your partner in pushing back against this terrible proposed legislation.
Right. Thank you, Angela. So I think this is important to sort of highlight here that, we've heard how devastating these bills, the repeal efforts are going to be. I mean, basically they're saying they're going to take they're going to take healthcare away from millions of people, increase costs for everyone. They're going to instead give tax breaks to the wealthy. And on top of that, they're also taking away access to healthcare for women and families. Like, this is right out of the gate. This is what Trump and Republicans are prioritizing. Of all the things that we really need, this is what they're doing. So it's great to hear from the two speakers about the actual, the nuts and bolts of the repeal bills. I'm now going to turn it over to Jacob Liebenloft from he's senior advisor at the Center on Budget and Policy Priorities. The Center on Budget, I mean, I know I read their materials all the time. They're really, great at producing amazing fact sheets and analysis on a number of things, including the ACA and these repeal bills. So very happy to have Jacob on. Jacob?
Thanks, Angel. So I get the privilege here to talk to what may be the largest audience in history who has ever been asked to get psyched up about the Congressional Budget Office. But we thought it was worth taking a few moments as the House rushes this repeal bill forward, as we see the first committee votes this week, to discuss why it's so outrageous that they're doing so without a CBO score. And here's why this is so outrageous and why it's something that we really should be calling out. As the president seems to have discovered recently, healthcare is complicated. And a score from the Congressional Budget Office, an independent, nonpartisan office entrusted with providing analysis to Congress, helps sort through what a complicated piece of legislation actually does. And so what do we mean when we talk about a score? Whenever there is a pending piece of legislation, CBO will put out an analysis about what it does. And in this case, a score would not just show how much a bill costs, but it would show how it affects the number of people who have health insurance or the premiums that they pay, for example. In other words, when we ask the question of whether people will be better off or worse off under the House bill compared to the ACA, a CBO score helps us answer that question. And typically, we'd expect that when leaders in Congress introduce a new complicated bill, like this repeal bill that Republicans put forward, and they ask members to vote on that, they would do so with a CBO score at the ready, so they could explain what the legislation does and how it might actually affect people. Indeed, before the Affordable Care Act was passed 7 years ago, that's exactly what happened. Not only were there CBO scores, but there were over 200 bipartisan meetings and hearings. In fact, the bill that became the ACA was online for public review for 3 months before the House voted on it. So that raises a question, which is, why are congressional Republicans rushing a repeal bill without a CBO score? And our best guess is that it's because they have a pretty good sense of what a score would show. Remember, CBO has already scored a repeal bill, one that Congress passed in 2015 and President Obama vetoed. It found that repeal would increase the number of uninsured by 32 million people and double premiums in insurance markets by the end of a decade. Now, this new repeal bill is different, and we don't know exactly what CBO will say. But as Lydia described, we still know, first of all, the bill will leave millions of people without coverage by ending the Medicaid expansion, by going beyond that to end the basic Medicaid program as we know it, putting coverage and services at risk for seniors, for people with disabilities, for families who rely on it for care, and by putting affordable insurance out of reach for millions of other families. We also know that the bill could significantly raise costs for people who do still get insurance by providing much less in tax credits for families who need them to afford coverage, and by making it more likely that healthy people leave the market, leading premiums and costs to rise for everyone buying insurance. Finally, we know that the bill will do all this in order to pay for large tax cuts for the wealthy, for pharmaceutical companies, and for insurers. In fact, our analysis finds that repealing the Affordable Care Act would provide a tax cut on average of $50,000 a year for the average millionaire and $7 million a year each for the 400 richest households in the country. So that's a sense of what a CBO score would show, but knowing the exact impacts of an ACA repeal bill requires that score to be public, and that's exactly what Republicans should provide before they move forward. That means that it's critical this week, as House committees plan to vote on a repeal bill, to make clear that it is simply unacceptable to consider legislation of this magnitude without knowing what it would actually do. And it also means that if and when a CBO score does come out, we'll need to make clear that if it makes millions of people worse off, dropping people from coverage and raising their costs, that's not legislation that Congress should be rushing forward.
Okay, thank you, Jacob. Super important. I know I've been here. I mean, there was a press conference today where Sean Spicer compared their process to the ACA process and said that, back in 2010, they jammed it down people's throats. And really, what we're seeing is the opposite, where we haven't gotten a score. We just got our first glimpse of this bill. So this is super important. The process matters also. It's not just the substance, which is also obviously what we're seeing is terrible, but the process also matters. So thank you, Jacob. Then our next speaker, our final speaker here is Claire McAndrew. She's Director of Campaign Strategy at Families USA. Again, great respect for Families USA and all the work that they've done. So Claire's going to talk a little bit more about some of those core things that we want to see, that we want to keep and preserve. Claire?
Sure. Thank you so much, Angel. I'm Claire McAndrew, the Campaign Strategy Director at Families USA. And now that you've heard details on what is in the GOP healthcare repeal bill and why it matters so much that we don't even have an official estimate from CBO on its true impact, I would just like to drive home what it is about this healthcare bill we have seen from Republicans in the House of Representatives that warrants an emergency nighttime call. This bill is about healthcare, but it is about more than that. This bill proposes to take a system based on core values of health, financial security, and peace of mind, and replace it with a system that values increasing the wealth of those who already have money to spare, leaving people to fend for themselves when they are most in need, and cutting back care from populations most of us have been taught that our society should care for the most, like seniors, kids, people with disabilities, and people with chronic illnesses. So it takes a system we have currently under the Affordable Care Act, built on the principle that when you are already struggling from illness, you shouldn't have to worry about how you will pay for care, and throws people into a market where they will have to fend for themselves with plans that provide less coverage and higher deductibles than what we have now. So I know all of you on this call do not want to stand for that. You have really powerful voices, and I know you are some of the absolute best at getting the word out when things are not what they should be here in Washington. So we need to let our elected officials know that the health and financial security of people across America is not negotiable. Republicans, including President Trump, promised us they were going to deliver a better health plan compared to what people in America have now. We have to hold them accountable for that promise. Specifically, we must demand that no repeal bill passes unless it provides the same quality of coverage and the same level of protection to as many people as the Affordable Care Act. That means telling Congress that you will not stand for, number one, cuts to Medicaid. Those cuts will hurt low-income people, seniors, kids, and others who rely on the coverage and care that Medicaid provides. Telling Congress that you will not stand for the gutting of subsidies that people rely on to make insurance affordable. And finally, telling Congress that you will not stand for the defunding of Planned Parenthood, a provider that delivers a wide range of critical services to women and men. We heard from Angela, sometimes it's people's only source of care in locations all over the country. I also want to mention that sharing your personal stories when you deliver these messages can really make a big difference. Sharing why you personally or your family or people in your community will be affected by efforts to get rid of affordable health care is a very powerful way to advocate. You can also share your stories with us at Families USA if you visit our website. It's familiesusa.org, and you click on the Share Your Story button. We will contact you before we ever use your story, but the stories we collect are used for members of Congress in their floor speeches, for members of the media who are writing feature stories on how people would be affected by the repeal of health care, and for other purposes in the fight to protect health care. On our website, you can also find a number of other resources for the fight to protect health care, and if you particularly go to our Protect Our Care initiative, you will find a lot of tools there. So in closing, I really want to thank you for everything you're doing. The Indivisible Network amazes me every day, so please do not stop. Keep up your work, because it is people like you who have made it harder than Republicans ever thought it would be to repeal this law. But it's only because there is continuous, everyday action that we have a chance of blocking it further, blocking it from moving through the House, through the Senate, and protecting health care for millions across the country. So do keep it up, get your voices out there, and tell Congress that you want to see them save health care.
Great. Thanks, Claire. And thank you to all of our great speakers. I'm just going to wrap this up with before we get to questions, is, some of you might be wondering, what does this all mean? We've heard from all the experts. We've heard about what's in the bill. We've heard about how bad the process has been and, the way that Trump and Republicans are trying to spin it, which we know is not true. But why this? Why now? This is the first major step in the repeal process. It's pretty simple. This has been the priority. This is a priority for Trump and Republicans. This is the first thing that they're focusing on. They can't do anything until they get through this, right? And this is going to really set the tone for the next 2 years, 2 to 4 years. So if they can't pass ACA repeal, if we stop them here, we really we really take the wind out of their sails, right? We stop them in their tracks, and that's super important for protecting all of our issues, not just the ACA. We care about ACA, we care about people's health care, we care about the quality of the health care, but this is about stopping the momentum of a new president, and this is the number one priority, and that's why it matters so much. So, at Indivisible, we believe that constituents have power, right? And we've seen them in town halls. We've seen them all over the country, in every corner of the country, how constituents can get together and they can really pressure their members of Congress. And through that pressure, through that constituent power, we can really stop a lot of these bad things from happening. So what we're asking for is we have a couple of asks for folks on the call. The first one is no score, no vote. As Jacob just laid out, the process here is flawed. They're not giving us the necessary information to really review a bill, and that's unacceptable when we're talking about millions of people who might be losing their coverage, when we're talking about an erosion of benefits and higher costs for people. It's unacceptable that members are voting on a bill that they don't know the full effects of that bill. So what we're asking people to do is call your members, visit your members, go down to the district office, make sure that you are asking, that you demand to see how this bill is actually going to affect you. So no score, no vote is our first ask. Again, we have to know the full impacts of a bill before anyone can vote on it. The second ask that we're making here is to really, as Claire laid out, there are some core things that we want to preserve no matter what. Right? We want to make sure that healthcare coverage remains affordable. We want to make sure that the coverage is robust, it's good quality care. And we also want to make sure that everyone who's covered under the ACA, at the very least, everyone who gets covered under the ACA keeps their coverage, right? We want to keep quality, we want to keep affordability, and we want to keep the coverage for everyone. So that's the second ask. We want to make sure that you are telling your members that you won't accept anything less than that. It's simple, right? And it should be common sense. And if you contact your members, they will listen. So we really encourage you all to get out. So with that, I'm going to move us over to a few of the questions. Thank you to everyone who submitted questions. The first question we got, actually, we just got it, it's the most recent question we got, was who is speaking? So I just realized I forgot to introduce myself at the beginning, at the top of the call. So we just got a question about who's speaking. So I'm Angel Padilla. I'm one of the co-founders of the Indivisible Project, and very happy again to be here with all these great speakers. But now we can get into the more substantive questions. I'm going to start here with, let's go with, I'm actually going to go with the question. I've seen a lot of advice on how to engage with Republican politicians, but my senators and congresswomen are all Democrats who have already committed to stand up for me and oppose the ACA repeal. What actions can I take to support them and fight for my access to health care? So this is a question we get a lot. What happens if you do have a good member, a member who is saying the right things and will vote the right way? Well, they still need to hear from you, right? We're in a situation where we're fighting to the end for this, right? And there will be a moment where some of these members who have said that they, don't want to see the ACA repealed might have to take some tough votes, and they need to hear from constituents to make sure that they stand strong on this, right? We can't lose any of our good members, so they need to hear from you. They need your support to make sure that they can continue to oppose ACA repeal. That's super important. Moving on here, I'm going to go with, please explain the repeal and replace process. Do they need 50 votes to repeal but 60 to replace? Can the repeal of the ACA will it leave people with no insurance in the meantime? Will they negotiate their plan? While they negotiate their plan? I'm wondering, is that a question for Jacob, maybe?
Sure, I'm happy to take that. So what we expect congressional Republicans to do is take up this bill in a process that's called reconciliation. And the key thing to understand about reconciliation is that it only requires 50 votes in the Senate to pass, not the 60 votes that would usually be required for most legislation to overcome a filibuster. However, there are limits to what what kinds of measures can be considered in a reconciliation bill. To be clear, the House bill that was introduced as a reconciliation bill. So if they get the votes, if they get a majority in the House and a majority in the Senate, that will become law, and that is effectively their plan for the ACA. They will continue to say, and the president said today, for example, that they are going to try to pass other measures that might require 60 votes in the future. But we should assume that whatever this House bill does and whatever CBO says that it will do in terms of millions more without coverage, higher premiums, higher costs, that's going to be the new system we face after the bill passes. And there's really no guarantee, and I wouldn't expect that any future bill might pass. So the quick answer is that this bill is essentially the ball game, that this is the new system that we will have in place of the Affordable Care Act if it passes.
Great. Thank you, Jacob. Moving on here, we have another question. We have this question. See, it says, my understanding of the new bill is that Medicaid expansion will be revoked in 2020. What happens to the millions of underserved people then? How about someone from Families for this one?
Sure, this is Lydia. So yes, the bill would end the Medicaid expansion in 2020, and basically starting in 2020, no new enrollees could enter into the Medicaid expansion. What's really important to know, though, is that, people who have the Medicaid expansion now, if they lose their Medicaid eligibility at any point of time, which is very common with people on Medicaid because their income fluctuates so often, they will lose that Medicaid expansion and roll off of expansion. And so the takeaway is that this will quickly starve states of expansion funding, and the people who are on Medicaid expansion right now will quickly lose that coverage as they have a change in their income. And so effectively 11 million people who are covered through the Medicaid expansion across the 31 states and the District of Columbia right now will quickly lose that coverage. In terms of what happens to them, I think the vast majority of them are very likely to go completely uninsured at that point. There will be the financial assistance that I discussed in the remarks that the House bill presents, but it's vastly inadequate. And for people who are in the Medicaid expansion right now, the lowest income people, it is not going to come close to helping them afford coverage.
Great, thank you. Moving on here, actually, here's a question that I know that I was wondering about earlier today, and we were, I know that we've gotten this question a lot, and that's what will happen to people with pre-existing conditions? I know that this is one of those issues where Republicans and Trump have said that it's not going to affect people with pre-existing conditions, but we know that's not the case. So I was hoping maybe someone could talk about that. Maybe another question for Families. I did.
Oh, did we lose Families? If we did, I'm happy to take it on.
Oh yeah, sure, Jacob. We may have lost him. Jacob,
yeah, Lydia was dropped.
Okay, well, why don't I take a stab at it, and if Lydia joins back, she can follow on. I think the quick answer is that what repeal does is basically take away the basic structure of the Affordable Care Act that finally allowed people with pre-existing conditions to get affordable coverage. That was a structure that included things like the individual mandate, like tax credits that Lydia described that match the cost of coverage for working families. And so what we would see, as sort of Lydia laid out, would be a real breakdown in the individual market, and all of a sudden we go back to the days where for families, including families with pre-existing conditions, care would no longer be affordable. So on paper, some of the pre-existing condition protections that were included in the Affordable Care Act would be continued. In fact, they have to be continued under the reconciliation rules. But in practice, those protections would mean almost nothing at all. People with pre-existing conditions would be right back to where they started before the Affordable Care Act. stuck in a health insurance market where they couldn't actually afford coverage.
Thank you, Jacob. Super helpful. Moving on to another question here that that we got here. It says, would immigrants be hurt by the bill? And this is one actually that I can take because I have a little bit of a background in this. So under the repeal bills, immigrants would definitely be harmed. So something that was really incredible about the Affordable Care Act is that it recognized that there were a lot of lawfully present immigrants, people who were here lawfully, who were excluded from affordable healthcare programs. And what the ACA did is it opened up access to healthcare to a lot of lawfully present immigrants. What we've seen already from in this plan, but it was also a part of the Tom Price, the new secretary's plan, was a restriction in access to immigrants. So again, this is lawfully present immigrants who currently have access under the ACA who would be stripped of their access if Republicans are successful in passing this repeal bill. And what's important to note here is that when people talk about, preserving coverage for everyone under the ACA, that is, immigrants are a part of that. There are lawfully present immigrants who have access under the ACA, and we want to make sure that we keep that because we really can't guarantee, we can't say that we're preserving, that we want to cover everyone, we want to keep everyone's coverage if we start dividing and picking and choosing those communities. So very important that this is a key thing to keep in mind, that immigrants are also potentially on the chopping block here with this bill. I'm not sure if anyone wants to add to that, but
sorry, this is your moderator. I'm just going to break in for just a second. I'm going to dial Lydia back in. When I do, you're going to hear a brief ring. So that goes for everyone who's on the call. Apologies for that noise. But please wait 1 second while I do it.
Hi, everyone.
Hi, Lydia.
So sorry about that.
No problem. Okay, so just moving on here to the next question. This is actually a really important question here because this is actually what Sean Spicer, the new press secretary, said in a press conference this afternoon. He said that, I've heard the he was saying that the process that they're using is more transparent than the process that was used to pass the ACA in the first place. And so this question gets to that issue, and the question is: I've heard that the Affordable Care Act wasn't evaluated by the CBO before going to committee. Are Republicans doing what Democrats did? Maybe Jacob could take that one.
Sure. I think it's hard to offer a bigger contrast between the kind of open and transparent process that led to the Affordable Care Act and what we're seeing here. I mean, as I mentioned, ahead of passage of the ACA, you not only had CBO score the head of every major committee and floor vote, but you had 200 bipartisan hearings and meetings. You had hundreds of amendments considered. You had, the longest markup in decades for the Senate Finance Committee and the second longest consideration on the floor of the Senate of any bill in history. These are all, odd pieces of legislative trivia, but I think we all remember, or those of us who are, whether you were following it as somebody concerned about what was happening in your own healthcare or perhaps pushing for the ACA, we all remember this long process that happened ahead of passage. And, I think there's nothing there's no greater contrast to what we see now, where we had a bill being locked in a basement room last week and now being rushed through a committee vote without any real information as to how it would affect millions of people across the country. So, all of this comes back to the question of, do Republicans who are introducing this bill want people to understand what it does? If they do, they should be more than happy to have an open and transparent process with independent analysis that says what it does, and we can have a debate over that. That's not what we've seen. We've seen an effort to jam this through as quickly as possible with as little information as possible, and we can only imagine that says something about what the bill would actually do.
Thanks, Jacob. Super important. I mean, I remember back in 2010, those long hearings, and it was like a year of debate for this bill. So the fact that Republicans are trying to jam this through this time, definitely agree with you that the contrast is going to be bigger. So I actually, there's a question here that I think is really important, and this is open to anyone who wants to answer it. But we've been hearing talk about, progressives and Democrats don't like this bill for all the reasons we laid out today. We've been also hearing that conservatives don't like this bill, that a lot of conservatives feel that this doesn't go far enough. So does this mean that this isn't an important moment, that this is, because no one likes it, it's not going to go anywhere? I was hoping that maybe someone would talk about how that's not the case, why this is still such an important time and why we can't let up on these efforts.
Yeah, this is Claire, and I'm happy to speak to that a bit. I think that although we are very happy to see that there are many hurdles ahead to passing this bill, we have continued to see what we've been calling disarray in the Republican Party when it comes to finding consensus around the Affordable Care Act. We also know that there are hearings, scheduled days on the floor for this bill to vote a House bill out of the House of Representatives and move it over to the Senate. They have their eyes set on moving it over to the Senate floor, and they wouldn't be doing that if they didn't think they could round up those votes in the House. We know that members in the Senate are working very hard to try to negotiate among their party members to work on folks who have reservations, to try to get them to a place where they could come to an agreement. And so I know for folks here at Families USA, we never rest on making sure that we are mobilizing people, raising voices as loud as possible, because we truly believe the only reason we've been able to slow this process down at all is because of the tireless work of advocates. We think that people hadn't been calling out so loudly to their members every day, rallying, that this could have actually moved much more quickly. So although it's very good to see that they don't have all of their ducks in a row yet, that it's been harder than they thought, I definitely don't think we should get comfortable at all. That continued advocacy really needs to happen.
Yep, good point. And actually, this raises another point. Like, we've been saying that you should really be calling your member of Congress, and you should tomorrow make sure that they hear from you tomorrow. We have the committee hearings start tomorrow. But this is going to be a process that doesn't end tomorrow or Thursday, right? This is going to be a long fight, and so we need to make sure that you are all calling. But there's also something else that I think is worth mentioning, is that if your member happens to be one of those that are in that committee, right? If you have a member that sits on, tomorrow it's Ways and Means and Energy and Commerce, they also need to hear from you, right? Every member needs to hear from their constituents, but these members in those committees are at an important sort of choke point in the process, and they also need to if they're voting on a bill without seeing what it does, then they need to hear from their constituents. Super important. So just encourage folks to keep doing that. I know we're running out of time, so gonna move over here to another question, and that's what do Republicans mean when they say their bill saves money? Heard that a lot. Jacob, do you want to take a crack at that one?
Well, I think, first of all, it's a pretty crazy statement to give without a CBO score. I mean, there's really no way to evaluate exactly what the bill does without CBO. That's what they're there for. But also, I don't think we expect that their bill will save money. What their bill does, remember, is provide hundreds of billions of tax cuts, probably in the range of about $600 billion when we see the final score, we expect. These are tax cuts for the wealthy, for pharmaceutical companies, for insurance companies. And that means that even though they are cutting Medicaid deeply by ending expansion and by really ending the program as we know it through these caps, as Lydia mentioned at the beginning of the call, those savings are really only digging them out of the hole that's created by the massive tax cut they're providing to the wealthy. So in the end, what this bill is doing is not saving money. It's effectively cutting healthcare coverage for millions of people in order to pay for these tax cuts. And we expect that's what a CBO score would show.
Yep, good points, Jacob. I have another question here. This one is for everyone, actually. Curious to hear what people think, but The question is there a possibility of a plan that retains enough of the ACA to be acceptable? Does anyone want to take a shot at that one?
So this is Claire, and I think if the House and the Senate were in a place where they were really worn down, and maybe they would find that they weren't able to pass as much as they had wanted to, and they might start chipping away at smaller pieces. I think that's a far out scenario, but I think at this point where we stand, we really have a lot of non-negotiables, as I spoke to earlier. We don't want to see Planned Parenthood defunded. We don't want to see Medicaid slashed, and we don't want to see people left with insufficient coverage or insufficient assistance to pay for it. And right now, that is what the plans are all looking at. And so I think our definition of acceptable is very different than what we're hearing to be defined as acceptable within the Republican Party. And so I think unless we kept our work up really hard and got it to a point to where, they were really barely scratching the surface on repeal, otherwise we're not really looking to negotiate to sort of amend what they're putting out there and say, well, maybe we can tweak around at the edges and get to something we can all live with, because they are so far from it right now that our advocacy is really focused on pushing back at these core values that they are violating in their health plan.
Yep. And I can speak a little bit here. Totally agree with you, Claire. So I'm speaking from Indivisible. No, we're not going to negotiate on this stuff, right? So just to give people a little bit of an idea of how Republicans and Trump are approaching this is, we know that the Affordable Care Act works. It's been working. It's been 7 years since it was passed. It works. It's been working despite every effort from the Republicans in Congress to try to make it not work. It works, and yet they're going to repeal. They're trying to repeal something that works, and take away millions, health care from millions of people, give tax breaks to the wealthy, reduce people's the quality of care that people get, just because it's something that Obama passed. So for us, it's not. We're not negotiating when it comes to people's healthcare and the lives of people and families. And to be honest, it's not. It doesn't stop here, right? We need to stop them here, because this is just the first big fight that we're going to face under this new president. Moving on here, I'm going to go to. Let me see. Here's a question. Is it true that they want to take away maternity care? I wonder if that's a question maybe for Angela from Planned Parenthood.
Sure, I can jump in here and really then leave it to my colleagues on the phone with more expertise here. What I would just say is that, again, going back to the dismantling of Medicaid and the fact that we see over half of our patients that have come in the door with Medicaid, which means effectively they would not be able to access the provider of their choice, come to Planned Parenthood. That's even if it's for early maternity care. So this is unacceptable to us, and we'll continue to push back and fight against that. And I would love for my colleagues that might know a little bit more about if there's anything that they have laid out about maternal care, what that looks like.
This is Lydia at Families. I can take that as well. So, the House repeal bills that were introduced do not change the fact that plans have to cover maternity coverage. But I think we need to look at this from a bigger picture perspective. There's definitely appetite to undermine the core set of benefits that plans cover right now under the Affordable Care Act in Congress. And just because we don't see them in these bills right now doesn't mean we won't see it down the line. And then the other thing I'll say is that, there's two ways to look at this, right? It's what is covered under a plan and how much do people have to pay under a plan. And the direction that these bills are going right now, maternity coverage might be covered, but it's not covered until you pay $6,000 or $7,000 of your care on your own. And so I think, maternity coverage is definitely at risk. It's not something that's under threat directly in these bills that were introduced today, but definitely there has been indication from many members on the Hill that they're interested in rolling back the protection that women are guaranteed maternity coverage right now. And so we have to be very mindful of that. And we have to also hold their feet to the fire that, we deserve American people want to keep their benefits whole, but they also want to make sure that they can afford to actually get the care in those benefits.
Yep. So we're running out of time here, so I just wanted to maybe give folks an opportunity. Again, thank you everyone for being on this late call on such an important moment. Again, on the eve of the first committee hearings to repeal the ACA. I wanted to give everyone a chance to maybe share maybe some resources that they might have, a website or places where people listening in might be able to get more information. So how about, we go around in the same order that you guys presented, sharing maybe some links or resources.
This is
Claire.
Oh, great. No, Claire, go ahead.
I would just like to mention on the Families USA webpage, if you visit www.familiesusa.org and you visit the initiative section, the first initiative you see is Protect Our Care. And that's where you will find a range of advocacy tools, resources, fact sheets, et cetera, all around trying to uphold the ACA and Medicaid. So that's where I would direct folks. And again, the Share Your Story button on the homepage that I mentioned earlier.
Great. And Jacob, do you want to plug any resources?
Sure. So our website is www.cbpp.org. We already have some analysis up on the Medicaid parts of the bill, and I expect we'll have additional analysis throughout the week. And so please continue to go there. I believe that so many people from this call have been visiting it that the site may have temporarily crashed, but I promise you it will be back up shortly, and we are going to provide everything we can so that you can advocate to your legislators on this issue, and we really appreciate all the help.
Okay, thanks, Jacob. And Angela, any plug your resources?
Yes, absolutely. If you all go to PlannedParenthoodAction.org, you'll be able to find more information around ways to help Planned Parenthood. This month in particular around the defund, and then you have an opportunity to be a Planned Parenthood defender. We also asking, we heard this on the call, the message was very clear that you have to continue to actually be in contact and call your members every day, whether they're folks that are champions or otherwise. It's important that they hear from you. You can share your story, which is really important. If you go to on Twitter or any of the digital properties, hashtag #WeArePP or hashtag #IStandWithPP. And then lastly, I will just point out our defenders and many supporters around the country earlier this evening at 5:30 p.m., depending on what which time zone you're in. They actually showed up at their reps' offices and district offices all across the country. So we're just excited to do that and really stand with everyone that is pushing back against this terrible attempt to repeal the Affordable Care Act and defund Planned Parenthood.
Great, thank you. And just also want to plug in some indivisible resources. We have new documents online. So we have scripts on our website on the ACA repeal bills. We also have some fact sheets and some explainers on some of the process. So the things that you heard today, like a CBO score, like what that means, how the committee process works. We have all of that on our website. So I encourage people to go there to get more information about the process and why this is such an important moment. So I guess final thought, well, thanks again for all the presenters. Thank you to Center on Budget and Policy Priorities. Thank you to Families USA, and thank you to Planned Parenthood for joining. One last, I guess, final thought is, Donald Trump and Republicans are really hoping that we all get tired, right? I mean, it feels like it's been 2 years since Donald Trump took office, and they're hoping that we get tired. They're hoping for fatigue. But this is, again, we're talking about people's lives, and this is just the beginning. It's going to be a nonstop attack on the people that we care about the most. So this time it's healthcare access for millions of Americans. We also got a new Muslim ban this week on Monday. We got a ton of things coming on a number of issues, including immigration. But right now the moment is on healthcare, and we really need folks to come out and make sure that their members are acting as that check that we need. Right? We can't let this president get away with what's happening. And we can't let people lose their coverage. So again, encourage you to go and talk to your members. We also want to see a big showing again in the next recess. The next recess is only 6 weeks away. The goal here is to make sure that they don't pass anything before the next recess, and that members hear from constituents at the next recess that they're not going to put up with any of this. So thank you all for joining. I know it's late on a Tuesday night, but again, this is such an important moment that we really appreciate you joining and listening in. Thank you again to the presenters, and have a good night, everyone.